It was fantastic that within 1 year after the start of the pandemic that highly efficacious vaccines became available. But in fact, in this first year, we didn't have any pharmacological interventions. So the point is that we should have had antiviral drugs to treat the people that were most at risk, because we had so many people that died because of SARS-CoV-2. And just imagine that we had simple pills, potent inhibitors of coronavirus replication that we could give to these people, either as a therapeutic or prophylactically. This would have made a big difference. What would have been important is that before the pandemic, that the world had access to a pan-corona, a broad-acting coronavirus inhibitor, and we knew already 6 human coronaviruses. We had the coronaviruses causing common cold, and then we had also the SARS virus from 2003 and the MERS virus from 2012. So we knew 6 human coronaviruses. It was perfectly possible to develop inhibitors. Now, there was one molecule called remdesivir, which was once developed as an inhibitor of the Ebola virus, and the company Gilead Sciences, they had done studies in animals to show that it is effective against other coronaviruses. So this molecule was available at the time of the beginning of the pandemic, but the problem is that you have to give it via an intravenous line, which is complicating the story in a pandemic situation. An oral form of this molecule is now being developed, but it would have been, of course, fantastic if we had this already before the start of the pandemic. And then Pfizer developed during the pandemic a drug called Paxlovid, which inhibits the protease of SARS-CoV-2. And they could do this also very rapidly, because in 2003, at the time of the outbreak in Hong Kong of the SARS coronavirus, they developed basically an inhibitor of the coronavirus protease, and they continued for some time, but then when this problem in Hong Kong stopped, they also stopped this exercise. And in January 2020, when SARS-CoV-2 emerged, they had basically this information, this start of the project to further develop this molecule Paxlovid. Paxlovid and also remdesivir in patients with SARS-CoV-2, if you start treatment within the first 5 days of onset of symptoms, it reduces hospitalization and mortality by 90%. So it shows the potency and the potential of pan-coronavirus inhibitors, but the drama is that we did not have this ready at the day basically that SARS-CoV-2 emerged.